After having multiple teeth removed, oral hygiene will be important. The best thing for keeping that area clean will be salt water or normal saline rinse. Use that twice a day to keep that area clean. It's okay to brush your teeth that might be adjacent to the extraction sites, but make sure to not brush so vigorous that you make bleeding happen again. After having multiple teeth removed, bleeding can at times be an issue. The most important thing to do is to make sure you're using a moist piece of gauze and biting on that. Make sure that you apply firm pressure. Make sure that you keep your head above your heart while resting and don't lay flat. Also, be careful about avoiding carbonated beverages or beverages that might be too hot. One of the things that might make bleeding worse is getting up and doing too much too fast. If you end up getting your heart rate or your blood pressure too high, bleeding can be prolonged. If you've been taking a blood thinner of any kind, make sure that you've discussed that with your doctor. This will make bleeding last much longer, and you'll have to be aggressive with your preventative measures. If you've had multiple teeth removed and bleeding is going on into the evening, it would be best if you would call your doctor and talk to him about that. It's common to have swelling after having multiple teeth removed. This will peak 3 days after the procedure. After your procedure, if swelling sets in, it's okay to use moist heat applied best through a towel that you've put in the microwave, and you can use that for 20 minutes at a time. Some people prefer cold, and that's also acceptable. One of the things that will make you swell more is if you lay flat after having your procedure. And so if you will make sure that you rest in a recliner or with several pillows under you, it will keep swelling to a minimum. After having multiple teeth removed, it's important that you stick to a diet that won't make this worse. Usually, things that are crunchy or rough in your mouth will aggravate that area. I think temperature extremes will also make this worse. Try to stick to cool, smooth foods that will protect that area. Post-op pain can vary from patient to patient, and it's very important that you follow the instructions that you are given while you're at the office. Right after surgery, it's important that you take your pain medicine before the numbness wears off. This will make a smooth transition into your recovery so that you can start off with a positive experience. After the first day, you'll be able to know better on how you're responding to the pain management of your procedure. We would like to get you off of the narcotic pain medicines as soon as possible and transition into over-the-counter Tylenol or ibuprofen. It's important that you use your pain medicine if you need it, but if you can transition to over-the-counter Tylenol or ibuprofen, the nausea and vomiting will be much less. The doctors will often prescribe Zofran or Phenergan for you, and that can help. If you take that 20 minutes before you take your pain medicine, that might have time to set in before the narcotic makes you nauseated or sick.